Hello, Jan Shimano here. I'd like to ask you a question. Whether you would know if a person was having a heart attack or a stroke, if they were in front of you and they were having some kind of an attack. Could you tell the difference? Well, the symptoms and the effects of a heart attack and a stroke can be very, very similar, but they are different medical events. However, both of them do involve the blood vessels, and they both can be the result of progressive atherosclerosis. And I always have a hard time saying that word. Now, this occurs when the arteries are narrowed and blocked by fatty deposits. In a heart attack, there's a blockage of one of the blood vessels that supplies blood to the heart. But in a stroke, the blocked blood vessel is one that is supplying blood to the brain. So the heart attack is going to cause damage to the heart muscle, and the stroke is going to cause damage to a part of the brain. Now, the stroke cannot only be caused by a narrowing of an artery inside the brain, it can also be caused by an aneurysm, and that is where there is a weakened blood vessel inside the brain itself, and then that weakened blood vessel becomes so weak that it bursts. Some of the signs and symptoms of a heart attack include chest pain, shortness of breath, palpitations, fainting, fatigue, sweating, and cold sweats, and nausea and vomiting, along with anxiety, panic, and heartburn. So there's a long list of symptoms that would lead a person to think that they were having a heart attack. But because the symptoms of a stroke can sometimes be very similar, it is important to know that there are definite warning signs for a stroke. And according to the American Stroke Foundation, there are 5 warning signs that are specific for strokes. First of all, sudden numbness or weakness of the face, arm or leg, especially just on one side of the body. Secondly, sudden confusion, trouble speaking or understanding. The third one, sudden trouble seeing in either one eye or both eyes. The next one, having sudden trouble walking, dizziness, loss of balance or coordination. And the fifth one, sudden severe headache with no known cause. Now, with all of these symptoms that I've just mentioned that deal specifically with strokes, every one of them I started off with saying sudden numbness, sudden confusion, sudden trouble seeing, etc. So in all instances, when a person has a stroke, they are going to experience very sudden symptoms. Now, because the person might be confused, they might not comprehend themselves what's happening to them. So if you happen to be around someone like this, then it would be up to you to recognize this symptom and to call 911 immediately, because there's a time frame, there's a window of opportunity there for treatment, and there are particular drugs that are called clot-busting drugs. And as far as a stroke is concerned, if these are administered within 3 hours of the onset of symptoms, then there's a very, very good chance that this treatment is going to be very, very beneficial for the person that has had this stroke. So there are some of the differences, and when you have this knowledge, if you're with someone that you think has either had a heart attack or a stroke, then this will hopefully give you enough knowledge to take immediate action. I hope you found this helpful, and come back another time and check out my other videos. Thank you very much. Bye-bye.